This segment is sponsored by Reston Hospital. Reston Hospital Center's trauma education team is dedicated and passionate about providing injury and trauma education to all members of the community at all stages of life by offering a variety of free classes at the hospital. And I got to meet these passionate healthcare educators who hope that a little knowledge goes a long way. What kinds of educational opportunities do you offer here at Reston Hospital Center at the Trauma Education Program?
So we have Matter of Balance, which is a program that is really geared for our older adult population who fear falling or have fallen in the past. And it's a small group discussion. They get together, they talk about myths about falling, they talk about behavior patterns that could put them at increased risk. We introduce some gentle exercise that they can incorporate into their daily routines so that they can reduce their risk of falling. We also were very excited here in a couple weeks, I think, June 3rd, we have our Saving Claire event coming. It's a screening of a play for older adults, and it's about what happens if you don't take the precautions and don't listen to your physicians about the fall prevention methods. And so it's a play about the consequences of that. It's nice because at the end we'll have an expert panel to talk to participants. There'll be a pharmacist to talk about how medications interact together and increase the risk. There'll also be a blood pressure screening and time to mingle and ask specific questions afterwards. It'll be cute. We'll have popcorn. It's like a little movie day. We also have things for motor vehicle collisions. That's another type of injury we see. Last program that I'm going to talk about is Stop the Bleed. So the number one preventable cause of death after injury is bleeding, penetrating injuries. So we're talking about gunshot wounds, we're talking about stabbings, whether accidental or purposeful, kitchen accidents, things like that. We're teaching the participants to recognize quickly what life-threatening bleeding looks like so that they can intervene, and we're equipping them with 3 techniques depending on the scenario that they can apply. And the goal for that one is to stop the bleeding so that EMS can get there and transport the victim to the hospital where they can get care.
So the other piece that we do is nursing education. So all of the classes that Jamie talked about are free to the public. The nursing classes that we're offering right now, we are so excited to have the Trauma Certified Registered Nurse review. So that's for a board exam. It does cost a small fee, but it's very competitive pricing. Our goal is that we're able to share this with the community and really increase and enhance the standard of nursing care, not only in Reston, but for everybody in the local area. The other class that we're doing is the Emergency Nursing Pediatric course. So this is a really great one that focuses on not only pediatric trauma, but pediatric emergency nursing in general. And this is one that not everybody has access to, and not everybody's as comfortable with pediatrics. So it's really great that we're able to share those with the community.
Yeah, for sure. So many different topics. Sarah, how do you decide which programs you're going to offer?
Yeah, so we look at the patients that we're seeing coming in for traumatic injuries, and we look at the top mechanisms. So for us here in Reston, the top mechanism of injury that we see is falls, particularly in the elderly population. So that's why we do the Matter of Balance and the Saving Claire events. We are also seeing a lot of motor vehicle collisions. So think about where we're located, all the main roads. That's one of our major types of injuries that we see. Another one, a very small percentage, is the penetrating trauma. And as Jamie mentioned, this could be, a shooting, a stabbing, but it could also be something like a kitchen accident, or somebody's working on a construction site, or you're just doing yard work outside. So it's good to be prepared for all of those instances. The last thing that we're thinking about really is a very small percentage, but has potential for serious injury. So we're thinking pedestrian injuries and also bicyclist injuries. So for those ones, we do things like we go out into the community and we do events like National Bike to Work Day. We'll be at a pit stop off the WNOD trail. And we also participate in community forums to promote pedestrian and bicyclist safety.
Oh, so great for the community. Jamie, what is the goal of providing these programs?
I joke with people sometimes about this. I think we're one of the few disciplines that really tries to put ourselves out of business, right? So we work very hard to provide education, resources to our community to prevent them from ever being injured in the first place and prevent them from coming to the hospital. There used to be a school of thought that when accidents happen, it's like the world acting upon them. They can't avoid it, things just happen. And what we've learned in recent times is that injuries are actually a disease, preventable disease. So there are behavior patterns that can predict if you're going to have one of these accidents. there are risk factors in the environment that we can modify. And so we want to enable people to learn and modify those risk factors and prevent the injury from ever happening in the first place. Now, that being said, injuries will still happen despite our best efforts. And so our secondary goal is we want to equip our community members to be ready if an injury does happen, what to do, how to appropriately respond so that stop the bleed, right? They're already injured, they're bleeding. So we want them to be ready to respond timely. And also we want them to be physically and mentally prepared for that outcome too. So one of the things we teach in our Matter of Balance class, along with the exercises that help strengthen them, we teach them how to get up after a fall. So the combination of the lessons and the strengthening creates a scenario where they're not stuck. If they fall, they can get back up and they can ask for help.
And Sarah, you offer programs here, but you also go into the community?
We do, yeah. So one that we did recently last month was we partnered with Westfield High School, the criminal justice class, and we took Stop the Bleed to them. And we were able to put, I think, 121 students through over a 2-day period. So they're much better equipped to manage that and hope they never have to use it, but it's a great skill to have.
Community members can register for these free courses by visiting restonhospital.com. You can find all of the dates and times of classes being offered under Classes and Events.